Hi everyone, I'm Paige Abbott and this is your weekly recovery message on the topic of detoxification. I really believe from clinical experience that a period of detox is absolutely necessary for the brain, the body, and the mind to have a cool down period from whatever it was actively engaging with. Now, obviously, if this is drugs or alcohol, this may need to be done under medical supervision, and it needs to be done in a very thoughtful, careful way. However, there still has to be a movement towards some kind of abstinence. With drugs, especially opioids, there may be some medication-assisted treatment in there, methadone or Suboxone. Again, there's still a cooling off or detox period that happens even when someone is switching from a street opioid or a prescription opioid to something like that. There's just a different capability for people to think, for clarity of mind, and for feelings to start coming to the surface. I hear and I get a lot of pushback from clients, many who are very frustrated and upset because when we start to look at addiction beyond the realms of just drugs and alcohol, detox becomes a little bit more complicated. So what does it mean to detox from food or sex or relationships or work, money, spending, that sort of thing? And I agree, it is more complicated and it is more complex. However, I still believe it is necessary in order for people to gain a period of clarity within themselves that will further their recovery momentum. It really depends on the individual. So it's important to learn over time what key features seem to be activating your brain the most strongly within those areas. So with food, for instance, you will gain some clarity over time as to certain substances that seem to have more activation than others. And therefore, when there is some awareness of where that activation may be coming from, then taking steps towards abstinence and a period of detoxification to promote recovery is possible. I also get clients who say, well, how do I know? Sometimes I don't know what's activating. And that's true. Over time, though, you will start to gain some clarity, especially the more that you are engaging in abstinence from other behaviors and other substances. Yep, the disease will keep trying to engage with other things to activate itself and get a hit, but there is an increased clarity, and I've seen that in many people that as time goes on, they're able to feel and perceive when something has activating potential versus when it doesn't. So yeah, initially something may be intoxicating and you're not aware of it, but once there is awareness, then looking at some sort of detox period would be important. And often it's very difficult after you've detoxed from this particular part of a behavior or a substance to go back to it and engage in any kind of moderate or healthy use, just because the brain has that desire for more. And this was something that was activating in the past. It's very doubtful that it won't be activating moving forward. But these are bottom lines that you'll need to continue to be aware of and cultivate some action around over time. Detox is a complicated arena, especially, like I said, when it comes to the realms outside of drugs and alcohol. Even with drugs and alcohol, of course, it's emotionally, physically challenging. However, at least we have more kind of medical protocols and more structure around what we can do. But I do hope you will give yourself the gift of your own recovery and looking at what you may need to take a step back from, because sometimes we don't even know how triggering or activating something is until we've taken a step away for a period of time, and then you'll gain some clarity. I wish you the best in your ongoing journey of recovery. Thanks for watching. Bye for now.